Good morning, everybody. Happy Friday, and welcome to a new and different version of VC Notes. Since I became the Vice Chancellor in March of 2015, we have put out a VC Notes every Friday. I was worried early on that we wouldn't be able to have fresh content every single week. But as it turned out, in fact, the list of potential items to discuss, the list of different bits of news that we want to bring forward, the important information that I want to share with everybody at the medical center has only grown over time. I have really been amazed and surprised. A lot of what feeds the decisions about what to include in VC Notes comes from you. The people who read the VC Notes, the people that comment back, the people that ask questions. And as I've had the opportunity to say many times, I really appreciate that very much. That's what keeps it alive and keeps it fresh and keeps it fun. Starting this year, January, this new month and this new year of 2021, we're all really glad to have turned the page, I think, on 2020 and now looking to 2021. And hopefully that brings us some really different experiences than we had last year. But looking at this year, one of the thoughts is perhaps we tweak the VC Notes format and the way that we've been doing it just a bit to keep it fresh and to keep it fun. So this is the first foray into doing it like this. It's going to be a coffee talk style. I've got a guest here with me today. Somebody who qualifies as a guest, but yet is also one of our own, a member of our faculty here as well. Dr. Thomas Dobbs is with me, and we're going to have a conversation and share some things with you. So this is the first effort along this line. I'll be very interested in your feedback to see if you like this. There are a lot of people, both internally and externally, that I would love to bring in and have conversations with. So I'll be interested in your feedback. I want to hear how you think this translates and how well it goes over. The VC Notes have traditionally gone out in email mid-morning on Friday morning, and I'm always astonished how quickly people read them because literally sometimes within about 5 minutes of them going out, I've gotten some comments or some email or text message, some kind of reaction, which is fantastic, but a little bit surprising to me that people read them so quickly. With this format, it won't be the kind of thing that you can pull up on your computer and read quickly. It will be a video to watch, and that may take a little more time. But we want to hear your thoughts about it. I think this will be fun, not to do every Friday, but certainly just to sprinkle in throughout the year. I've got another idea or two of different things to potentially sprinkle in. So your response and your feedback on how this is received by the people who have been traditionally reading the VC Notes will be important to me, but I'm excited about trying a couple of new things. So to that end, the guest that we have today here is Dr. Thomas Dobbs. He is our state health officer and has been a member of our faculty now for several years. And I knew him at some level this time last year. But boy, over the last 12 months, I've gotten to know him at a whole different level. It feels like on a daily basis, for sure, some member of our team is in communication with his team, and he and I are in very frequent communication. And it has been a fantastic relationship, one that I have valued very highly. So I'm really pleased to have him here today and to have the opportunity to have a bit of a coffee talk with Dr. Thomas Dobbs. So welcome, Dr. Dobbs. We're very pleased to have you here with us.
Well, thank you. Thanks so much for inviting me. This is going to be fun.
So we're trying something new. We'll see how this goes. Yeah. You're our test subject. One of the things that I would love for you to tell us a little bit about and just to hear is how did you get into this kind of work? What is your own education background and your own sort of career path that brought you to this job that I hope after the year that we've had, you're still you still feel good about and still feel passionate about? Tell us about that.
I'm from Alabama, although I do have Mississippi roots. My mother was born in Shelby, Mississippi, not kind of a small place right now. It really is.
I
Up in the
think,
Delta.
I think now you're at the point in your life where you can say, I am a Mississippian.
I'm a Mississippian.
All the work you've done for us, you are a full-fledged Mississippian.
Well, I've lived here longer than
Yeah.
anywhere now,
Yeah.
for sure. But did most of my medical training at UAB, did a short stint at Wake Forest, and then got my MPH from UAB as well. And then I am internal medicine doc and infectious diseases. Mm-hmm. We were in North Carolina and actually wanted to move kind of closer to home. My wife is from Mississippi, and so we moved to Laurel and fell in love with the town and have been there ever since. Now, and here too, obviously, we're kind of like that sort of family back and forth. But in med school, I knew I wanted to do something a little bit more population-based, and I think that was the decision. And for a while, thought about doing preventive health residency, but thought that you wanted to maintain that clinical capacity, and then ID was a good mix. And then when I was in residency program, really wanted to do tropical medicine, and so I hooked up with the School of Public Health there and joined the Gorgas Public Health Institute and got to do some neat stuff. I spent a month working in a Russian gulag.
Wow.
That was fascinating. I've got stories galore. And then you got to work in Southeast Asia. I made several trips back there working with HIV and tuberculosis stuff. So learned pretty quickly that really enjoyed the public health, population health model. Have done a good bit of clinical practice, but intermixed with sort of a traditional clinical practice. Been doing public health stuff. I've been doing TB consulting. I did for CDC. I did regional consulting for a while. On top of these things, I mean, that's the thing. There's no one way to public health. It's 1,000 ways, and no one way is the same. And then hooked up with the Department of Health, the state epidemiologist, health officer for a while in one of the regions, and then had been back at South Central as one of their VPs and as a clinician in infectious disease before the board hired me as the state health officer.
And when was that? How long have you been in this role?
A little, just a shade over 2 years.
Yeah,
It's been an interesting 2 years.
I knew it had not been very long.
No, not very long.
And what about your family? Tell us a little bit about your family.
So my wife is pulmonary critical care doc in Laurel, and so she's been busier than I have. It's just these past couple of months, so it's been insane. So we've been
really able to give you the perspective of the person who's in that intensive care unit. Yeah.
So I've been able to kind of see both sides of it, from the the personal view and also the the overview. And then I've got 2 kids. I've got an 18-year-old who's at School of Math and Science, and a 25-year-old son who is in Washington D.C. in med school at GW.
I wonder if he'll follow in your shoes along this public health and population health pathway.
Well, he is taking a year off to get an MPH at Hopkins. So
there you go.
There may be some parallel.
I think as this year has gone along, and it has been such a tough year, you had toward the end, before we wrap this up, I do want to talk to you specifically about some of the next steps with vaccine and kind of the next things you see on the horizon for the next month or two. But before we get to that, it's been an exceedingly difficult year on every level, and you have done an amazing job. I just want to say that we at the medical center appreciate what you have done. I appreciate what you have done. I know everybody in the state of Mississippi appreciates it. Who would have known that this would be the life that we've all had this last year? But thank you for what you have done for the state of Mississippi. It's been tremendous. As the year has gone on, in so many ways, we have tried here at the medical center and in other conversations to think of things that might be silver linings to the year. We have learned a lot. We've learned a lot of things. Here at UMMC, we really ramped up our telemedicine usage last early summer and late spring when we were diverting patients and not having our clinics open. We learned, we did a few things faster than we thought we could. The development of an in-house test, so many things like that I would consider the silver linings and good things that have come out of the pandemic and things that we don't want to lose. This year, as we got into the fall of this academic year and the current time we're in now, that's the application process to our professional schools here. So whether it's medical school, dental school, nursing, health-related professions programs, all of our schools, it's the application cycle. And honestly, I worried a little bit that, in fact, young, motivated, intelligent, inspiring people who have a lot of choices in what they do with their life might have seen what's happened in this pandemic and decided this is not for me. But one of the really great things, or something that has really been very positive, our applications to all of our health professional schools have been at an all-time high.
Wow.
So in fact, it's inspired, I think, a lot of young people that this is a good thing. From our standpoint also, seeing the role that research played, whether it's clinical trials, the development of a test, that has been a silver lining. And I would think and love to hear your thoughts on, I feel like this pandemic has also really highlighted the criticality and just how important having a strong public health infrastructure is. I don't think in our state we have had a very robust public health infrastructure. I think it has been functional, obviously, but I know other states have something that's a little more robust. But this, I think, has highlighted the need and the importance of it. And what are your thoughts about that?
Gosh, no, you're so right, and it has highlighted some things. It's presented opportunities for growth, but it's also really demonstrated some critical vulnerabilities, right? And I kind of think of the public health system in Mississippi, but also in the United States, very similar to America's preparedness going into World War II, right? We were underinvested, we were underaware, and just not really didn't have the full complement of resources available. One of the kind of crazy things that's happened over the past couple of decades is there's been a mindset shift that public health equals clinical access to care, and they're just not the same thing.
That's right.
Having health insurance is not public health. They're totally separate. There are some overlaps, right? But we've seen a phenomenal decline in funding for public health at a state level and at a federal level, on a inflation-adjusted rate. With the Affordable Care Act, there was supposed to be a parallel increase in public health spending along with clinical spending for folks, but the clinical spending did go up, but the public health pot of money got kind of swiped away. We have to have a robust public health system. It's like we're like the first responders, basically the army for health protection for our country and our state. And I hate to tell you this, but this isn't the last pandemic.
Well, I was going to ask you that. Over the last 10, 15 years, when there have been pandemics declared, and SARS and MERS, flared up in other parts of the world, and maybe we had a little bit of it here, but certainly not at the level that we've had this COVID-19 experience. You almost get in a place where you feel like those things that are happening in other parts of the world just aren't going to come to us. And in fact, maybe if there is a little bit of an outbreak on the West Coast or on the East Coast, it probably won't come to Mississippi. Somehow, we feel, like it, and history would bear that out. There have been some pandemics that really haven't had much impact here, Ebola, et cetera. But this one has. This one, there was no place, I think, on earth spared. All around the world, this one has infiltrated and had a big impact. And what would you hope to see as our learning from this, our takeaway points, so that in fact we're ready for the next one in a way that we weren't ready for this one?
Most public health support has been reactive throughout my entire career. We've been through several sort of big things, right? In my life in public health, we've seen West Nile, right, unfold. We saw H1N1. We've seen chikungunya. We've seen Zika. We had the Ebola scare, and we had the opioid thing, right? And we're still working through the HIV thing. But what we've seen in the funding is the funding comes about 6 months later. It's a lot more money than you can use, and then it's focused on that one thing and it goes away. And so what we need is steady, but also flexible support. You don't have an army that just fights North Korea or some other country. You have a military, or you have a response framework, or
can
you have
deploy
a
as
fire
needed.
department that's
Yeah.
not just for houses. You also have one, it covers buildings and all kind of things. So we need a steady strategy and support for public health. Not only do we need steady, but we also need to sort of rebuild, because if you look at the public health nurses, we have about half the nurses we had even 4 years ago, right? Because again, and part of it's not only a funding issue, but an pay equity issue, because we've seen, health care folks have had and you know this.
Oh, I know this very well, yeah.
Pay scales have increased,
Yes,
but state
yes.
governments have not, essentially, at least minimally. So
We feel that every day in our struggle to stay competitive with the market, with our nurses and our respiratory therapists and everybody. It's a very real thing.
we just got to really be open-minded about having the public health workforce, the preparedness force that we need for the current challenges, but the future challenges. And that's something that through my whatever national advocacy that I've been involved with is trying to help people realize that, because the irony is we would have saved money not only in the preventive side, but in the pure dollar side. Because if you'd taken 80% or less of all the money that we had spent on all these different things, chikungunya and Ebola and whatever, and just said, hey, we're just going to
invest in the infrastructure.
and we're just going to give it to you steady stream, and y'all just build it up. Accountability, you got to have accountability.
That's right.
There's no doubt.
Right.
We would be in a phenomenally better place, much better place.
So, do you think as a nation we will learn from this and on the go forward have a different approach? This hasn't been a Mississippi problem. It hasn't been a Southeastern problem. It hasn't been, this is a worldwide problem. Mm-hmm. And of course, what they do in the rest of the world, it may well be different. But as a nation, do you think we'll learn from this?
I don't know. And I'll tell you, we were kind of discouraged with the appropriations last year. In the middle of the pandemic, we had a pretty sizable budget cut. That was even sort of disproportionate to our budget. So we're hoping that folks will realize that we have to invest, and it has to be at a state level. It needs to be at a federal level. We have short memories, mm-hmm. and and we also we have heart disease every year. We don't have a pandemic every year, and so it's hard to keep people's eye on the prize about, hey, we got to be ready. We got to be ready. But maybe when 9/11 happened, we did build up our response infrastructure a lot better.
We did.
With our, with HHS or Homeland Security and all that. So maybe, but it's not assured. Yeah. Not assured.
I think about some of the things in my own career, in my own lifetime that I've seen and the changes that we've made. I remember being in medicine, and I don't remember if I was a student or a resident, but I remember being in medicine early on when it was not uncommon to go draw blood on somebody or start an mm-hmm. IV and you didn't have on gloves. Mm-hmm. You just went and did it. And mm-hmm. in fact, I learned how to start an IV with the, feeling for the vein without gloves on. And when I figured, when we all decided you had to wear gloves, I thought, well, this is going to be impossible. Of course it wasn't. But HIV is what really heightened our awareness of we have to just wear gloves in these mm-hmm. settings. And now it would seem ridiculous not to. After 9/11, we did change our security processes on a lot of things, especially air travel. If you had to pinpoint just a couple of things, what do you predict maybe or guess that we'll take away from this? I could see us in most healthcare settings mm-hmm. continuing to wear masks. Mm-hmm. I think to myself now, all my time in the emergency department, and taking my own children in to see the pediatrician when they were sick, and people are coughing and they're febrile and mm-hmm. they're sick, and we're all sitting there talking to each other with no mask on in that either emergency setting or clinic or whatever it is. And now I think, what were we thinking? I feel like a takeaway from this we'll change our behavior and wear masks more frequently.
Like in a sick clinic, mm-hmm. maybe you do need to do that. My wife, in her pulmonary clinic, sees people who have respiratory infections all the time, and until this year, she has had frequent recurrent upper respiratory tract infections. Mm-hmm. And she has been working more than ever and hasn't had a one. Mm-hmm. And she's like, I think we're onto something here. And I think, about airplanes too and travel. I mean, how many times have you been on a flight and you caught a upper respiratory tract infection or the flu
It seems like
or something
almost
like that?
every time.
Yeah.
Yeah.
And, the air's really dry in there and not to mention surfaces and stuff. So, I do wonder, there won't be some circumstances where we think masks might be beneficial going forward. But, and I think just even for our public safety, probably for the next few months, we're going to need to do it. But if we can get the virus down a little bit more, maybe we can moderate and go to, more less widespread necessity.
Yeah. We, just for the folks that are watching us and to know, because we're sitting here without our mask on, but we are spread apart. We have both been vaccinated, and we came in with our mask on.
We did,
so,
yeah.
Just as I'm talking about that, and then feeling a little bit awkward that we don't have ours on, but I think we've got the bases covered
Yes,
on that.
we do, yeah.
So if you had to, just in a few sentences maybe, describe this last year, what would you say, has kind of been the highlight and maybe the low point? Just thinking back on this last year, we have been very busy here. I've been busy. We've been in constant communication, but still nobody else has been walking in your shoes. Those shoes that you're wearing, you have been in those shoes, and I'm sure there have been times when it has felt a little lonely. And the path of what to do next has not been well defined. So many things there've been moving variables as we've gone along. What would you look back and say this year has been?
Boy,
I know.
There's so many things.
I know.
Well, I can tell you what the most stressful thing is. The most stressful thing is when you have limited resources and a lot of people want them, right? So the most stressful time that we've had was early on with the PPE issue.
Yeah.
And everybody, every board of supervisor, legislator, CEO, I actually had to hire someone for the sole purpose of answering my cell phone.
Oh my goodness.
For several weeks. And so, and it's not that there's more PPE, there's just more anxiety. And it was a little bit of that this week with the vaccine because, we have a limited supply, but a lot of demand. But that's just part of it.
And it's great that we have a lot of demand.
It is.
Fantastic.
It's fantastic. Yeah.
Yeah,
We'll work through it. It's
Yeah,
going to be
yeah.
okay. It's just, sometimes stress is just inevitable. But I will say that it has been a pretty remarkable experience and sometimes stressful, but it's also an honor and a privilege to be able to serve. I'll say that one of the things that people don't realize is the huge role that UMC plays in this response. UMC is our critical healthcare partner as part of the emergency response framework. So y'all are in the pandemic response plan. Y'all are in the hurricane responses. Y'all are one of the critical partners in this sort of the jargon of the essential services functions. Yeah. And whether it's y'all's lab, it's been with clinical care, clinical guidance, system of care management, right? Making sure patients are taken care of, helping us with the scheduling. And y'all have been a critical partner in every step of the way. And that's one of the unknown stories of the pandemic is the role of UMC.
Well, and that it has been, people have asked me about how are you doing what you do? I know you're worn out, all of those things. And that's true, but almost like you said, it really has felt this last year like we were just made for a time like this. This was the time to bring all the resources to bear. And the team that we've got around us, it is that I've got around me has been phenomenal, and we have been delighted to be able to be part of it and want to be able to be part of it. But all that said, you are still the only state health officer with kind of that carrying that flag and leading that charge, and I know that it's probably been an experience like none other this last year. I hope that you don't have another year like this in your career. I hope this is the one and only, year of the pandemic. But I do, we will get on the other side of this whenever it is. But I think that there'll be some permanent changes, permanent things that we'll do differently from here on out.
I do hope so. Other things that are huge, I think, is the importance of science and the importance of rational, evidence-based decision-making. I hope that that's a lesson that we learn, because this is the age of Facebook medicine, right? And, people are doing crazy things. People are jumping on every new fad, whether it's hydroxychloroquine or inhaled budesonide, and sometimes these things might have benefit, right? But to know that, you have to look steadily at it and do the scientific process. I hope we learn from that. Hope we learn, and the same thing with management of critical care patients. I mean, I think we recognize
a lot.
That one of the main reasons that people were dying so much early in the pandemic is not because it was it is a new illness, and there are some unique clinical manifestations, but it's not that folks were dying at a large percentage because it was new. It's because we overloaded our resources. We were unable to do the basics, the essentials. Because if you do the basics and the essentials, looking at y'all's mortality rate early on, it was very good. I think y'all had in ICU, about 30% mortality for ICU patients, compared to, early on they were saying 80% of people die, whatever. But I think it highlights the importance of having that academic foundation, a research institution, and then making sure that and I consider us public health scientists, that we promote and advocate evidence-based practice.
And access to the internet and quick access to information, we can't imagine our life without that now. Before we started this, Thomas and I were actually talking about, you remember med school when we had to go to the library and pull an article?
A real book, yeah.
So we cannot imagine our life without that instant access to the internet and the role that social media does play. And it can be good, but probably when it's all said and done, I would say one of my biggest frustrations in this whole thing has been people who are not in healthcare, not in medicine for the most part, their either inability or unwillingness to understand that this has been a fluid and a dynamic situation, that we have learned a lot from this time last year. We've learned a lot from July of last year until now. So treatment methodologies change, recommendations change, and just some of the chatter I've seen out there on social media where people either don't believe the science or don't want to understand that it is evolving and things will change as we learn more. I've been disappointed in that in a lot of ways. I know people are desperate for information and they want the quick story and the quick answer, and they don't want it to change in 3 months, but that's just not the way the reality of it is. And so that has, we've learned a lot, and there have been a lot of silver linings, but dealing with the misinformation out there has been challenging.
Yeah, I tell you, that's been the funniest thing. You could almost write, I almost wish David Sedaris could write a book about, the myths and the legends that surrounding coronavirus, because it would be, I couldn't write it in a funny way, but, all the mythical guy who died in a motorcycle wreck and they put coronavirus on the death certificate. That's one of my favorites, because then I say, I'll track it down and I'll say, well, that is awful. Who is that? Well, I don't know. I saw it on Facebook. Well, who was the person who posted it on Facebook? And you look back and it looks like some Russian troll did it. So it's
yeah. That has, you say funny, and I guess sometimes it is funny, but boy, that has frustrated me a lot, just that piece of it. So thinking about the vaccine and the rollout of the vaccine, you mentioned, the demand being high, and that that's so energizing just to know that there are a lot of people out there that are eager for their time, eager to make their appointment, and we're rolling as fast as we can. I think everybody involved is very committed and very vigorous in their efforts to get as many people vaccinated as we can. And I know that you don't always know what's going to be made available to Mississippi in advance. We don't have, as we mentioned before, it's that evolving, moving target. We don't know. But what would you say to people who are thinking, what's next? Are we going to get some more vaccine next week? Is it going to be next month? Do we know how much we're going to get? What just at the big picture level, what are your thoughts over this next month or two about vaccine and the availability of vaccine for everybody that wants to get it?
It's going to take a little bit of time. I'll just start off with saying I really hope as we go forward that the federal government can cooperate internally. Because what we've seen is this constant struggle between HHS and CDC, and it's like having two parents who have different.
We're bickering.
Yeah. So
it only adds to the confusion.
It does.
We don't need that at this time.
We
don't need it.
We need unity. We need stability, and we need a good strategic vision. And so that's something that needs to happen. So that's kind of the foundational thing. So I think that's hopeful for the future that, and we have a good connection with CDC and talk to them all the time. So I think that's going to be easier now that we have the vaccine also. As far as like the vaccine supply, it's unpredictable. And so that's one thing that's very important. And it's also limited. Yeah. So we do have a sense that we probably will get a steady supply, a steady trickle of vaccine, but it may be, it's kind of like, 0.1% of the population every week, okay, right now at the current sort of pace. We don't know what we get until next week, like yesterday. We just found out yesterday what we're going to get that we can order today for next week.
Right.
And we're living on real-time inventory, at least we are. So all these clinics that we have scheduled for next week for the drive-thrus, it's what we schedule them based on anticipated inventory, but we don't know for sure. So, it's kind of like we're kind of rolling based on anticipation.
And I know that's hard for people to understand.
Mm-hmm.
Everybody just wants their vaccine. This is the day of Amazon, and you order it tonight, and it shows up tomorrow night, and you never had to darken the door of an actual store. It's on demand. You get what you want. Mm-hmm. But I think that the more we can get that message out, that it's not that you are not ordering us vaccine, or that anybody is not doing their part. It's just that we don't know what's coming from week to week to week until very far into it. And you've got to do some plan. It's hard to plan for mass vaccination when you don't know what you're going to get or when you're going to get it. That is a challenge.
It is a challenge, and it's super challenging for the clinics. And I tell you, I've spent hours on the phone with frustrated folks, and I understand their frustration this week because they need to say, I got to schedule these people next week. How much can I get? And I say, I
that's
don't know.
A reasonable question.
It is a very reasonable question. But I think it is going to get better going forward. I think especially as we get a few more people vaccinated. Personally, I think that the vaccinating the medically vulnerable folks first did make a lot of sense, and that's actually what we advocated for to CDC. They chose the essential worker priority, and we said, okay. And then they ditched it, and so it's a little bit, we're getting a lot of whiplash going on, but we'll adjust, and it'll be okay.
And I know some of your messaging, the governor's messaging, our messaging, state medical. I mean, I think everybody is trying to get that message out to folks to say we are getting as much vaccine as we can, and we're getting it out as fast as we can, and our number one priority is get everybody vaccinated that that certainly that wants it and needs it. I hope. I've been very pleased, and not that I've taken a statewide poll or anything, but just from our own workforce and people here, and the emails and the text and the Facebook messages and everything that's coming through on my phone. I've been very pleased at the receptiveness across the larger community of people that want to get vaccinated.
Oh yeah, absolutely. That
has been really good. I know early on there were a few, even healthcare professionals who said to me, I don't think I want to get it right away. I want to wait a little bit. And it seems like we've turned the tide on that. I think I'm not hearing that nearly like I was. Now I'm hearing people in healthcare and people outside of healthcare, family, friends, strangers, all saying, I want to get the vaccine, or as soon as I can, I'm going to get it, and I'm planning to get it. And that's very encouraging, because I think that that is what's going to help get us over this hump,
I
get
agree.
us on the other side of it. What are you seeing and thinking about our next month or two as far as burden of illness, hospitalizations, those sorts of things? I I know in a couple of different settings you have said January is going to be a tough month, and we're seeing that. We're seeing numbers of deaths. And what are your thoughts about this bit of time that's ahead of us right now?
I'm hopeful that we're going to see a declining case burden. What we've seen is I think people are a little bit scared for a good reason. I mean, we had 1,000 deaths in December. We said, hey, we were going to have 1,000 deaths in December, and people said, that's not possible. I said, well, you just wait. And we did. And we're going to have more than that in January, almost certainly. So I think people are paying attention, I think because they've lost loved ones too. I lost a good friend last week, and I was really, really upset about it. He didn't have to die, and it makes me angry. That just because someone wants to look at some conspiracy thing and think it's a bunch of nonsense, someone killed my friend. I hate to say it that way. Someone gave him coronavirus because he tried to be careful, and someone was careless.
Was not careful, right?
Yeah, but for the next month, I'm hopeful. We're seeing more and more people. What I'm hearing again, sort of just through the grapevine, is more folks are wearing masks. I think people are taking it a little bit more seriously. That's going to help. We've seen a moderation. I mean, we still had over 2,000 cases today, and which is a lot, but we're not seeing 3,000 cases. So maybe that's a trend.
Yeah.
But
it's been a few days since we've seen 3,000.
It has been.
Certainly, it's too soon to say it's a trend, or maybe that was our peak. I'd hate to say that with any kind of level of confidence, but it is encouraging that we've had a few days that we haven't hit that 3,000 number. That's been encouraging.
And I'm so glad we have a big chunk of time between holidays and spring break. This is our chance, right? Holidays have been killing us. I mean, if we look at what happened after Labor Day, after 4th of July, after Halloween, after Thanksgiving, after Christmas and New Year's Eve, it's our weak point because the masks are important. They're very important, and I think that makes a big difference. But the thing that people haven't really been able to fully engage and understand is social gatherings, meeting with people outside of your nuclear family. And I include religious services, and I mean, it's not really fun stuff like funerals, but anytime
Those
you're
types
around
of
people,
gatherings.
your risk is very high. And the holidays are a time when that happens a lot. And the way this virus is, it's kind of like not that contagious until it's explosively contagious.
That's right.
So we're walking around near landmines all the time.
Without knowing it.
Without knowing it.
I know last weekend, just within about an hour and a half time, I got messages from a very dear friend of mine all my life that her father had died. We lost a colleague, and then another individual that was more of a not a physician, but also a colleague. All just within a few minutes, I got those notifications, and you just think, oh my goodness, when will we get over this hump? So is there anything on your mind that you would want to share or to say that I haven't asked you? What would you, if there's anything that you would want to have people hear from you that I haven't touched on?
We have to remember health equity. And we knew about it. We knew it's an issue. But I think when we went into the pandemic, there's actually, I've got 1,000 stories about what went well, what went wrong, and kind of where some of the interesting things are. But we didn't understand the impact on the Black community until we were a week or two into it. I mean, and a week or two at the time seemed like it was an eternity, and now it doesn't seem like it's that long a time. But still, we were slow to the gate to say, oh my gosh, coronavirus is spreading rapidly in the Black community, right? And we saw a lot of cases, deaths, morbidity early on. Is whatever we do, we have to look at it through a health equity lens. And the two biggest ones are going to be racial disparities and geographic disparities. And if you look at those two for Mississippi, rural and then being African American, your risks of bad health outcomes are really high. We've got to have that on the top of our list. And as we're going through the next phases of this vaccine plan, 15% of the vaccines going to Black folks and they represent 38% of the population. So, and we started looking at that day one. And so that's an important thing to keep in our mind.
And when you think about the African American population and the rural part of our state, I mean, that's a tremendous part of our state. That really covers most of Mississippi. I was very pleased to see some of our own physicians here, Dr. Loretta Jackson and some others, be very public about getting their vaccine, and then you reached out to some of our African American physicians across the state and highlighted them getting their vaccine. I think that's very positive in encouraging others to get the vaccine and to show that there's trust and safety in how it works. I sure do thank you for joining me today and being part of this, first experiment that we have on the Coffee Talk VC Notes. This has been a lot of fun for me to get to visit with you. And I know you have not been holding your phone probably over there. You've missed 15 calls and 100 messages, but I thank you for giving the time to us to do this and to share some of your thoughts, your background, and your experiences this year. Thank you for joining us today.
Thank you so much for having me.
So this wraps up our very first episode of VC Notes in this format. Again, I would love to have some feedback on what you think about this. I have very much enjoyed having a conversation with Dr. Dobbs and hearing more about his thinking. There are a lot of timely topics that we could address this way in the future. So I hope that you have a good Friday. Thank you all for tuning in and for listening. And I'm thankful that we have partners like Dr. Dobbs that are helping us tremendously, especially him this year, on our path to a healthier Mississippi.